So if we make a start then, my name is Sally Cleet. I'm the Education Training Manager here at the school. My background is teaching and learning. I was a lecturer for many years in further education colleges and some at HE level as well. And reflective practice has always played a big part of my roles, but also teaching reflective practice as well to students across different subject areas, etc. So it is something that I'm very passionate about. And it was clear that there was a gap in the resources that we had in terms of developing the skill of reflection and reflective practice, because sometimes it's treated as something that is, really easy to do, and it really isn't. It does take time to practice, like any skill. And just telling people what reflective practice isn't enough. It's really important for people to feel safe in experimenting and practicing that skill as well. And what most people think of when they think of reflective practice is the models of reflection. And through the resources, trying to emphasise the point that actually they're just a tool. So whatever model of reflection you prefer or that you use, it's a tool. It's not it's not going to, it will help you frame your reflections, but it isn't the be all and end all of it. It's about how you undertake that reflection and what learning you gain from it. And like we say, models can help shape that, definitely. So when we're going to do, if there are any questions as we go along, you don't have to wait till the end to actually drop them in there. Like I say, I'll try, most likely that I'll respond to them after the session as a collective, so that they're all the ones that I've received I can collate together. There's been some common themes already that have made me reflect and think about maybe a little bit of guidance that might need to go out in relation to some of the curriculum elements which ask for reflection. And it's quite an interesting I find it interesting way of looking at it in part of the curriculum, which we can talk about after. So there you go. You just need to go to slido.com, enter the event code there, which the hashtag is already populated, and it's then reflect there. So you don't need to log in, and there's a Q&A tab that you will click on to ask your questions or comments, polite ones, but constructive comments are fine. Okay. So why are the resources needed? And the obvious answer to that question, and probably the immediate response to that question, would be, well, we're expected to reflect as part of our programme of study. So I'm on the STP. It's told me that under the rotations as a starting point for my phase 1 of learning, that I have to reflect on certain tasks, certain observations and that kind of thing. And of course, that's a legitimate response, to need these resources to help you achieve progress within your programme. But what I've tried to emphasise throughout the resources is that reflective practice is not something that should just start and end with a qualification or a course. It's a behaviour or a set of behaviours that we would like to be embedded within the workforce. So it's very common in nursing, and other clinical roles, such as training for doctors, and they're expected to do ongoing reflections, as well as allied health professionals as well. They're expected to as well. So your on par with them. And so the expectation should be the same, because we know that reflecting on practice leads to better practice. If the action is taken on board, the learning that is central to true reflection is actually utilised and applied. And we know that individual reflections can inform team reflections and the improvement of practice, not just at an individual level, but in a team and professional level as well, and within the profession itself. So interesting. Yeah, this is a quote that's not a quote, really. It's always bandied around as a quote, and by educationalists like myself and everybody, and then when you actually dig down, the actual reference is a little bit shady, and it's accepted that John Dewey wasn't as succinct as this quote suggests. He was quite a wordy fellow, and so it's recognised it's probably more of a summary of what he meant, really, an interpretation. So basically, we do not learn from experience alone. We would learn from reflecting on it. And you could probably think of examples in your own, not just professional, it might be on personal experiences that you've had an experience and you've definitely reflected on it and change your behaviour or change your attitude towards something based on that experience and actually reflecting on it. Whereas we can have experiences but not actually learn from them if we haven't reflected on them, because we end up repeating the same behaviours and getting the same result. So real learning and change comes from reflecting on that experience. And a good example of that, and sort of a good analogy related to that, and also related to the fact that we don't want reflection just to be something that you do for your course, and then when it comes to the end of your programme, so I'm qualified now, I don't need to reflect anymore. We know, and that we know really that when we've completed a training programme, that actually the learning continues and actually becomes a different, almost different in its nature once you've achieved that qualification. Because if you think of like learning to drive as a good analogy, you might learn to drive, you might pass your test first, second, third time, whatever. So you do enough to satisfy passing that test. But that doesn't mean you're suddenly an expert driver. The learning comes from the hours of driving that you put in. So that experience of, reflecting upon maybe near misses and how you responded to those, and how you might, discussing that with other people, and they say, well, next time try to, do X, Y, and Z. So we know that lifelong learning comes from not just having that experience, but actually reflecting on it and recognizing that there will be things that, that crop up that you might not have experienced during your training. And so it's this continuous learning cycle that you're involved in post and during your training. Okay. And we bring with us a lot of previous experience anyway to our new experiences that we're having. So benefits of reflective practice, it's recognised throughout health and care professionals, and this was a joint statement from all the chief executives of all the different health and care professionals, and they agreed that reflective practice and people becoming reflective practitioners benefits everybody, of those that are using the health and care services. So being reflective on an individual and as a group level, so at the team level, can support that development of multidisciplinary teamwork and actually improve that teamwork too, because they're looking at it in a more through a critical lens, not critical as in negative lens, but looking at it in a way that, goes beyond, well, we've always done it like this, so we'll continue doing it like this. It's about, well, what is it, are we doing the best for our patients? Are we doing the best we can in the most efficient way we can for that end user? And so that can lead to improvements in practice and services. And it assures the public that you're serving that the professionals within health and care are always seeking to improve. That continuous learning, that approach to lifelong learning, that they're embracing ways to do things better for them. Okay. And keeping up to date, things change in health very quickly, as scientists particularly, you notice changes in science happening all the time, and moving with that is really important, and reflection plays a key part of that. So as summary then, that we've already sort of talked about a lot of this already, why are we doing it? So the curriculum, if we start with that, in 2022, those of you that are on the call that started then, there was greater emphasis on reflection as an assessment tool. Now, the previous incarnations of the curriculum, so if some of you are in your second year or your third year, these resources are still relevant to you because there is an expectation of reflection in those curriculums, but it's less clearly defined in some ways, and there's not as much of an emphasis on it as in the newer curriculum. But it doesn't mean that it's not relevant, because it certainly is. As I've already mentioned, clinical reflections are commonplace, so amongst the other health and care professions. It's also around evidence-based practice. So your reflections, if you think of it in terms of your curriculum, it's important that the reflections you undertake are linked to evidence that you've observed or experienced. Okay, so although they are about how you might have felt about a situation, and feelings are can be quite obviously subjective and also a little bit abstract in some ways, but you will be linking it back to an actual experience and actual things that happened during that experience. And reflective practice leads to greater insight, and that's a really important emphasis in terms of the materials that have been produced and sort of moving forward as you progress through your training. It's about sort of trying to, improve in practice, and it's about learning. And sometimes what can happen if you're on a training program, or even, as human beings, particularly as we get into adulthood, failure doesn't seem like an option at all. We have to get everything right. And that's not the case. We don't learn, we learn from making mistakes. And as long as we learn from those mistakes, that is where it's really important. We're human beings at the end of the day, that we put safeguards in to protect people, but there are going to be times where you as a trainee, you're not going to be put into a position where you can do something that's got catastrophic outcomes if you get it wrong, if you're not ready to undertake that task. And that's why the competencies within your curriculum, in your curriculum, have been written in a way that scaffolds your experiences in order to develop the skills needed to culminate into undertaking an observed clinical event, for example, so that brings it all together. So it is scaffolded in a way that you can experiment, you can have a go, you can take it step by step, and reflection plays an absolutely fundamental part of you being able to learn from that experience, because you could go through doing a task, but if you don't take a step back and think what went well, what didn't go so well, and why didn't it go so well, and what am I going to do differently next time in order to be successful fully at that task, then the learning gets lost completely. So, and I've already mentioned, it's an essential component of lifelong learning, way beyond when you've achieved your training. You're going to be learning all the time from every engagement that you have with a patient, or even if you're not patient facing, rather, any engagement that you have with another professional, a team member, you're learning all the time. You're learning how to adapt your language for specific people, how you learn the cultural norms within your own, or you know, the organisational culture. There's all sorts of things that we learn from having experiences, but it's about taking that step back and reflecting on those in order to make the most out of them. Okay. So accessing the resources then, if you haven't done so already, there's two slightly different routes depending on what email access you have. So before I go through that, I will just show you. Now, I will need somebody to put their thumbs up so they can see this in a minute. So can you see my screen being shared there, or is it looking black? You can all see that. That's fab. I've been having really weird problems with Teams this week. Never happened before, and it's always typical when you come to deliver something. So just to show you then on here, if you haven't seen this page already, it's on our website and it tells you exactly what you need to do. To get to this page, it's really easy. If you go to the home, there will be, oh, it's gone. They've moved it today. That's typical. So if you search for reflexive practice, you will be able to get it. If you go to information and resources, it should be there, fingers crossed, yeah. So you can click on there and it goes straight to it. Okay. So it tells you about, you know, a little bit about the resources, that's fine. And then it's about if you have an NHS email or if you don't. So if you've got an NHS email, so if within your email, it's got NHS in it, then you can sign up for free to the Learning Hub without coming via me, without coming via anyone else. And I'll show you how to do that in a second. If you've already got an e-learning for health, which probably quite a few of you will have or will be about to, because a lot of the mandatory training that you have to go through as part of your induction and beyond, you know, some things have to be reviewed every couple of years or whatever. You go via ESR, and a lot of those things sit in the e-learning for health space. So you might find that you might already have an e-learning for health login, and you can just use that login to get into the Learning Hub. Don't worry if you haven't. When you go to the Learning Hub, and I will show you this very quickly, you will see a green sign in button. Underneath there's create an account, and you just go to there and it asks for your work email, and what will happen then is they will verify it their end and then give you access. Basically, it's really easy. And then you just go to the sign in whenever you need to sign in, obviously. If you don't have an NHS email, and that is for people, because we do have trainees and training departments that are private organisations that have NHS patients. So they work for the NHS, but indirectly, as it were. Okay. So it's, oh, okay, Felicity, I've just seen your message. It could be your end that you're having problems with, maybe. Okay, if it's just, normally it just would show black actually, so you're not seeing me at all, which is not a bad thing. Okay, I can always send you, yeah, you can always look back at the recording of this when we make it available. So if you don't have an NHS email address, you have to request permission to get access to the Learning Hub, because the Learning Hub is actually, yeah, it's designed as a space for people that work in the NHS, and it's an NHS platform. So we cannot, and the Learning Hub team cannot accept any requests via a personal email account, so Gmail, all those kind of things. It has to be a professional email, and it's got to be verified by us, really, to say, yes, these are legitimate people who want to access it. But also, I need your permission to be able to pass on your details. So I can't just go down the list of our trainees and say, oh, I'll just send all that to the Learning Hub. I need your permission to do that if you haven't got an NHS email address. So there's a really brief form. It literally asks for your name and an email address, basically. And it's just a statement to say, yes, I agree for you to pass that on. Then I just request them to create you an account, and they contact you directly with your credentials for that. So it's really straightforward. Once you're into the space, it'll ask me to log back in. So I will just sign in. You can save your username, you know, as like with any sites, really. And when you first sign in, you'll see something very much like that. Okay, that's the landing page for it. Quick way of just finding the resources is put in National School for Healthcare Science, but you can use the link that is on the website as well, and go to that, and you will see the catalogue in the right hand corner there, and that's our catalogue. And at the moment, apart from just a little bit about using the Learning Hub, there's the reflective practice in healthcare science resources there. Okay, you won't see any of this where I've got manage this catalogue. That's because I have those responsibilities. What you can do is you can bookmark it. Up here it would say bookmark, and that's what I've done with mine, so I can find it nice and easily from the home page if I need to. So it's really straightforward. What I will say about the Learning Hub as well, these are the resources that we put together for you, and it's going to be our platform for putting resources for training officers as well, and training packages for them too, which you can access freely also. If you're interested, because it might be something that you're interested in, especially when you get to phase 3, you might think, oh, I'd like to be involved in training other people. So, you know, looking at those resources is not an issue at all. But what you might find is that there are things on the Learning Hub that you're interested under other people's catalogues. And if they're open catalogues like ours, then you can access them. There are some, just out of just to show you, because I was quite interested to see this. There's a pathology portal, so if any of you are like, but it is locked, so I can't access that without requesting access. But if you're working in pathology, you can request that access, and it's up to those whoever manage it whether they give you access. But if you, it will normally ask why you want it, and you can put why you want it. So look for your own specialism. There might be some catalogues that are already set up, because this isn't just for the National School for Healthcare Science. This is for anyone working in the NHS. So they can create their own catalogues. You can create your own contributions too. Anybody can. So you can create just a community contribution if you wanted to there as well. So yeah, you could set up your own groups if you wanted to. It would be a good learning tool for you to use as evidence if you wanted to, especially as you go through your program. But anyway, let me go back to share this. But it's worth having a play and having a look around. You can't do any harm to it. And yeah, you might find something else of interest on there as well. Right, where am I? Let's see if I can get back on. Okay. I get very excited about this Learning Hub. I think it's a really good resource. And you can find, there's other, like I said, there's other things on there to look at. So we've gone through how to access it, what's there. What I will just mention now for you is that how I've structured it. So the structure of it is, if you haven't looked at it already, you'll see that there's 2 modules. The first one is very much an introduction to reflection and reflective practice, and I've written it in a way that assumes that people know nothing about it. And if you already know some about it, that's fine. You can skip a few things. It's not, you've got to remember these resources, it's not like it's a compulsory program. You can skip forward, you can skim read stuff, go back, revisit a few things if you're interested. But I've written it in a way because some people have very different views or different experiences of what reflective practice is. And I wanted to create, and we wanted to, as a team as well, create this sort of materials that link with your topic area. So as in healthcare science, because there's a lot of reflective practice resources out there for doctors, there's a lot for nurses, and they're written very specific to their professions, which is fine. A lot of it is still relevant, but I think it's important that you have your own version of that, really. And so that's the approach that we've taken with it. And you will see that there is, especially in module 1, this strong link, making strong links between reflection and the principles of reflection and reflective practice and the skills needed for reflection and reflective practice and what they develop, and the sort of components, if you like, and skills used and needed for science. And there is, educationalists would argue that reflection and reflective practice is a sort of educationally scientific process where you're evaluating evidence, etc. But rather than on a population of people or on on a bacteria or on another living organism, it's actually on yourself and your own behaviours and your own actions. But from the stance of the impact that has on your own work, but also the impact that has on the people that you have contact with. So whether that's patients, other professionals, or all of those people. So it is worth, I personally think, worth going through that and looking at what your own views and attitudes are towards reflection and reflective practice. Because if you feel quite negative about that, then that's going to really impact on how you reflect and could pose a barrier. So hopefully you'll get something out of it if you start from the beginning. Module 2 is taking it a bit further, and then it's actually developing those skills to be reflective and demonstrate reflective practice. And there's an example of a reflection on there. Now, it's quite a generic example. It's not linked to science because, of course, we've got 30 plus different specialisms, would never please everyone. So actually, I've picked one that was written by Jenny Moon, who's produced a lot of resources around reflective practice, and it's about a presentation, someone delivering a presentation. And actually that is something that you're going to do potentially as part of your work-based learning anyway. So it's just the content will be very different. So it's but it doesn't matter so much about what the reflection is about. It's looking at how that reflection changes or can change as it becomes more reflective, and what that looks like in compared to the first one that is very much a description and not really reflective at all. So it gives you an opportunity to assess and take a step back. But also a big part of module 2 is looking at creating a learning environment, or an environment that is promotes learning conversations to take place. So if I just skip forward, so as I said, looks at your values. And first module looks at models of reflection as well, but the emphasis being that it is a tool to aid reflection. But if you feel that a particular model of reflection you find really hard to engage with, don't use it. Because I've had it in the past with students that I've taught and assessed, they get so sort of bogged down by the complexities of a particular model of reflection that actually the learning and the reflection itself doesn't happen, because it's the tool itself isn't aiding that reflection. So experiment with different ones and see what suits you better. There's 3 that I've suggested on there, but there's so many out there, so you can pick, it doesn't have to be any of those 3 at all. It could be a different type. You could a lot of people working in education argue that you might use different models for different situations as well. So some might lend themselves better to one situation to another. Okay. Module 2, like I said, that is you starting to look at different things that you might focus your reflections on. Now, obviously in the curriculum, some things are dictated to you. So reflect on, follow this person around in a professional sense, and reflect on their role, etc. That is very prescriptive of what you've got to do. Whereas you might keep, so for example, in one file, there's a reflective log, I think they term it as in one file, and it is encouraged that you do a reflective log or diary, we used to call it. And that's not just like, oh, what I did today. It's maybe picking a specific event or that has occurred and you reflect on, that might seem pertinent to you, and you draw conclusions from it, and it can help aid you, particularly if, let's say, you had feedback on something that you were being assessed upon. You might decide to do a reflective account on that, because whether it was your first feedback that you had from your training officer or assessor, and it might be something that you want to take some time to consider. So there's lots of different ways that you can use reflective practice. Like I said, you get an opportunity in module 2 to analyse the quality of reflections, looking at common misconceptions as well and challenging those. But what's key, I think, in module 2 is the last 2, sort of critically examining to what extent there's a culture conducive to developing the emerging reflective practitioner in the department that you're working. And that's why, if we've got training officers with us today, it might be something that you look at. You might think, well, actually, maybe as a team, we could be more reflective. We could, maybe with the trainee, or develop our reflective practice skills, or take it a little bit further, particularly if there's a particular change coming up in the department, or it's the first time you've had a trainee in your department, and that involves some reflective practice on the side of the colleagues that are working with that trainee. And it might be that they need to, you all feel like it would be a good idea to actually reflect on that process, and whether there's things that you've learned from from having a trainee too. So there's lots of ways that reflective practice is used, and that's why we're saying that it would be really good if they're not just used by trainees, that they're used by other people within the department too, these resources. Okay. So there's learning activities throughout those modules as well. Some are very much based around, that you do at your desktop, asking you to do certain things. Or think about, how would you define reflective practice, that kind of thing. But also there's things that you can undertake within the workplace that you can discuss with your training officer. Throughout the 2 modules that are there, you're encouraged to share learning with other people, because sharing and having conversations and interactions with other people and getting their feedback about your progress, or having those 2-way learning conversations. And what I mean by that isn't someone telling you how they think you've done, it's having a 2-way conversation about it. So they give you feedback and you give them feedback about yourself, but also about things that you've observed. So it helps develop that environment conducive for that reflective practice, that reflective thinking. And that it's looking at developing sort of an environment that's psychologically safe to have those conversations, that you're not going to feel like if you admit that you're struggling with a certain task, that you're going to feel you're going to be shot down. And we know that your training officers wouldn't want you to feel like that, and the workplace wouldn't want you to feel like that. So it's developing that rapport and that relationship in order to be able to make it more conducive. And also, there's opportunities with some of those learning activities to develop evidence which may be appropriate for your portfolio, but that's something you'd need to agree with your training officer. But particularly the module on individual professional development, there might be some of the, it might help with some of that there. But you've got to, what we want to reinforce throughout it is that reflective practice is a skill. And so it takes time to develop, like any skill. So your early reflections that you might do as part of your phase 1 of learning will be very different if you practice that skill over your programme, will be very different to the ones that you do in phase 3. They will become more insightful, more, because it's not about the amount that you write, it's about the conclusions that you draw and the learning that you take from it. Because you could write reams and reams and reams about something that happened, but actually you're just describing it. Whereas you might write just a very short piece, but it's very insightful into what learning that took place. So, there's a balance to be had there. It's not always about quantity. Excuse me. So in terms of roles and responsibilities, just as a sort of summary, sign up to the Learning Hub, access those resources. You've got nothing to lose having a look. I recognise that reflective practice isn't always everybody's bag, but it is an essential component of developing as a healthcare scientist within the health, NHS and within healthcare as a whole, and working with people. When we're working with people, it's important that we keep assessing our own behaviours and making sure that they marry up to the expectations of the people that we work with and the expectations of the people that we are there to support and help. Engage fully with the resources. They take about 2 to 2.5 hours per module. I've sort of averaged it out, but then some tasks might take a bit longer if you're doing them in the workplace. But it gives you an opportunity to explore and start meeting people and having those conversations with people, which is really important. Share learning with others. Peer assessment can be really important. So if there's more than one trainee where you're in the department, and they might not be a new trainee, they might be someone that was partway through the program already, then you can learn from each other. So they can be a valuable resource as well, as those that are already qualified and working in the department. Complete the activities, engage with them. They're sort of open enough to give you a chance to explore your own department with a reflective practice lens, and involve your training officer. So, I did this yesterday and I'm really interested in finding more about how the department or the trust promotes reflective practice, and, talk them through. And if they're not sure, then that might trigger something for them to go and find out or to think about for the team as a whole. And if we've got some training officers here, it's provide time for your trainee to complete the resources. And they've got study time a week, and it won't take much of that time, and it can start them on the journey to reflective practice and help with those competencies that require them to reflect. Access the resources just so that you know what is being asked of the trainee. It doesn't mean that you've got to sit and do them, but you might have a skim through, you might pick out a couple of things that you think, actually, that would be a really good starting point for me to engage with the trainee to get them to actually start that process of reflecting. And so it can give you a few resources there to actually use with them directly. Encourage the trainee to engage fully with the resources, and build in some time during the one-to-ones to discuss learning from those resources, because it's not a wasted opportunity, because you can link it in with the tasks that they've got in hand, particularly around the rotations in their first phase. And finally, use coaching skills to develop the reflective practitioner. And I've put a little star there, a little asterisk, because we are, as I said before, I'm going to be using the Learning Hub for resources for trainers as well. And one of those on my big list that I've got of different topics that I want to develop materials for is around coaching skills as well. Now, that doesn't mean we're going to ask you to do an additional role. It's more about just doing your one-to-ones potentially in a different way, or approaching it slightly differently in terms of undertaking those one-to-ones. So coaching is quite an interesting skill or set of skills to elicit sort of more reflection from your trainee, basically. Okay. So benefits of the resources, hopefully they will aid progression, and they're written in a way to support you in developing your reflective practice skills progressively. So it's not saying, right, you've got to, there you go and write a reflective account now, we're expecting it to be X, Y, and Z. It's about, practicing that skill. That's what we want you to do. Those resources on the website are there, on the Learning Hub are there to help you. But obviously, after those 2.5 hours per module, not expecting these full details, really, 100% insightful reflections. Some of you might have already got that experience and quite adept at that. Others might not be. And so what I will say is practice that skill, but not just the written skill, practice thinking in a reflective way, taking a step back and thinking, okay, from the perspective of my colleague or a perspective of that patient, it felt okay to me, but did I meet did I meet their expectations? And getting feedback is really important as part of that. Asking patients for feedback is really important too. It encourages learning conversations to take place. It asks you to go and talk with your training officer, asks you to talk with colleagues about certain aspects. So that is the benefits of those materials, because it's starting to sort of it's starting to get you to use some of the skills that you need to develop as a healthcare scientist. So those interpersonal skills that you need to develop. It's got a global use, so it can be used by staff, qualified staff, as well as those that are training. Reflects the values of the NHS and really emphasises the roles of others in our reflections and our learning, okay, and puts the patient at the heart of practice. And some of you might think, well, I'm not patient facing, but your very existence, your role, and it's the existence of that role is for the patient somewhere along the line, whether you're patient facing or not. So it ultimately they're at the center of everything that you're doing. Okay. So top tips for reflective writing. If you go on the Learning Hub, you will see some top tips there. I will just give you, I'll show you, it will ask me to sign in again. Let me do this and I'll share my screen. Hopefully you'll be able to see it. Fingers crossed, we're doing all right, I hope. So if I just go to page 5, you will see top tips for reflective writing. So take your time over those. Hopefully it's reassuring. At the top there, I've put choose a model of reflection that best suits you, and that's really important. Experiment with them. You know, see which ones work for you and which ones don't. And don't get distracted by that model of reflection. If you're struggling to use it, then try another. And that's really important. That's a message that I keep reiterating. What I will say on that page that's really important too is about data protection and clinical reflections, and making sure that you have access to sensitive data. So making sure that you protect that data. It gives you some tips there on how to make sure that you anonymise that data. But we have got some information on our website about protecting sensitive information in one file too. So making sure that you're only uploading appropriate information, okay, within your reflections. Because really there is no need for any personal information to go in there about anybody. You can refer to people, patient A, patient X or whatever, to keep that. It's just really important we keep reiterating that with people too. And then the other one that I was going to show, just draw your attention to, open that link up. Should be able to see that. The link is in the other resources bit of the reflective practice resources. But I just thought this was a nice way, if you're struggling with reflecting, on Hull University they've got these lovely sort of prompt questions, really reflective questions to think about, to make sure you are being reflective. And sort of picking out a couple. If I distance myself from the event and observe my reactions to it, does it change my perspective? And that's a really key thing about taking a step back and observing it, as if you're having almost like an out-of-body experience, looking at it from the outside and saying, would I change what I did by looking at that situation? Following feedback from other people. What are my interpretations about what happened in that event? Okay, so there's some really good reflective questioning there. Within the resources as well, there's some prompts by Jenny Moon. If I can, let me just see if I can find them. I'm doing it back to front. So, yeah. Questions to support reflective practice. So ones to facilitate reflection, and questions that are likely to be helpful in prompting more profound reflection. So think about those. What I will say as well, there is a real power, and there's a lot of evidence to show that in research around reflective practice. There's a real power of engagement with reflection when it's written down or recorded in some way. So if you're somebody that struggles with physically writing it down, using voice notes or recording it just on your phone, your reflections, in a way that means that you can revisit them, that can have a real profound effect and help you develop those reflections more deeply. So that is just something that's reiterated within those resources as well. Okay, so let's go to where we were. We will be seeking feedback in around 3 to 6 months' time to see how, so it gives people a chance to actually use the resources and access them. So I want to capture as many thoughts as possible, because it's important for us to reflect on whether they're fit for purpose. Obviously, we're not going to be able to satisfy everybody. There's a lot of people who started in 2022 in September, almost 600 of you. So, statistically, we're not going to get 100% engagement with it. We recognise that. But if there's things that we can change, because they're just not, there's common things that people are finding a frustration, and that could be down to some of the functions of that I've decided to use to illustrate certain things. If people find that those annoying, they're not very user friendly, then we can change those really easily. If some of the content you're using it and you think some of that is a little bit confusing to me, it might need rewriting, tell us. It's fine. I won't take it too personally. I won't at all. It's all about reflecting and making improvements our end as well. And of course, it's all very well me thinking that they work well, but I'm not the one using them for real. So it's important that we get your feedback, because there's no point developing these things and nobody touches them because they're a source of frustration or they're not meeting the needs that people want. So it's we want them to work for people and we want people to engage with them. Okay, so watch this space. We will be asking for your feedback in the very near future.